Good morning, good morning. Happy Friday, everybody. Welcome to this Friday's Facebook Live. We do have an awesome special guest. We have Lindsay from the radio station U93, so the best hits. So if you guys are interested, definitely turn into U93. But she is here today. She's been having some different symptoms, which is very normal for being a mother. She actually had twins, and I see you guys all popping on, so thank you for the wait for that. I know we're getting a little late here started today, but so she actually has different types of symptoms that she wants to get balanced, and so she's a perfect candidate for our BioTE hormone pelleting therapy. So today we're going to go ahead and talk to you about that and some different people who would be candidates for that. And Kelly, our nurse practitioner here, she's the main provider that actually does this service. Dr. Downs does it as well. However, she's going to be talking about that today. What is BioTE, how it can help you, who's the perfect candidate, pricing, all of that. So we're going to get started with that, and they're ready to go. So here we go, BioTE. I'm going to flip the camera. Hi. Hello. Lindsay, hi. Say hi.
Hi.
The viewers are climbing left and right.
Really? I'm ready for this.
Say they know they heard you on the radio on Wednesday.
Yes.
About it. They're excited.
BioTE. I am very excited.
I know.
Because my libido is down, and my weight is up, and my thyroid isn't doing what it's supposed to. I don't have enough vitamin D in my system. What else did I learn? My estrogen is low. Thanks to my 3 children for that. Yeah, so I'm ready to get it fixed up.
I know. So Kelly's our nurse practitioner.
Hello.
And she does our main of our BioTE. She's a certified BioTE provider. Yes, I was going to say specialist. She's a specialist. So first of all, I want to know, because our viewers want to know, what is BioTE?
So BioTE, it's bioidentical hormones. So when we say bioidentical, we mean it's molecularly identical to what your body would produce on its own. There's a lot of concern and a lot of scariness surrounding the Women's Health Initiative. The study done in 2002 used synthetic hormones, Premarin specifically, and they looked at, they studied women that were taking it, and they found that it was increasing the risk for breast cancer, heart attack, stroke, but they were synthetic hormones that they never even looked at bioidentical. So, they've been researching bioidentical hormone replacement for 75 years. It's just kind of now hitting the mainstream with pelleting form, but it has been used in the past with treating women that have had hysterectomies. Again, when we say bioidentical, it's not the non-synthetic, so it's molecularly identical to what your body would produce, and it doesn't carry those side effects that would come with the synthetic hormones. It's actually going to be protective of your body. So bioidentical hormones offer protection. The studies have shown that it offers protection against osteoporosis, Alzheimer's, dementia, cardiovascular disease, breast cancer, bone health, like I said, osteoporosis. So it offers all those protective benefits in addition to making you feel better.
So what would be included in these hormones?
In the pellets is only the estradiol and testosterone. So if we look at your lab values and find that you're deficient in maybe vitamin D, like Lindsay was talking about, that would be an oral supplement that we would prescribe. Sometimes thyroid, we look at your labs. If you're hypothyroid, we would provide a bioidentical thyroid or a desiccated or compounded thyroid. The same with progesterone. They are looking at trying to put progesterone into the pellets, but it's not complete yet. They're still in kind of a testing at that point. But the only thing available in the pellets at this point is estradiol and testosterone.
So, and I know that when I went to class, I learned that there's different types of ways you can get hormones. Correct. So explain to me why pelleting is better than, or the safest than the creams and injections.
So obviously it's better than the oral. You're going to get a nice steady state with the pellets. You're not going to get this roller coaster effect. A lot of women, when I tell them I'm going to pellet them with testosterone, they're like, whoa. I don't want to go into roid rage. I don't want to grow facial hair. I don't want a deep voice. So that's kind of the misconceptions or myths surrounding it. It's actually a mood stabilizer. So you're going to get a nice steady state mood. You're not going to get that roid rage that people are scared of. Any side effects that come with pelleting, the most common are very temporary, but treatable. So by what I mean temporary, they usually resolve as your body gets used to the level of testosterone in your body that we pellet you with. So the main side effect that we see is fluid retention or swelling, of the hands and feet. If that persists beyond a week after pelleting, we put you on a low dose of a diuretic and it clears right up. Sometimes if you're more prone to acne breakouts, you can get some acne from the testosterone, and again, until your body gets used to that level of testosterone. But again, we treat you with some doxycycline and it clears right up.
Perfect.
So the side effects are temporary but often very treatable. But to compare it to creams, we're kind of comparing it to the oral. The creams are going to be, you're not going to get a consistent dose. It's kind of a hassle. You have to apply it more than once a day. You have to wash your hands vigorously. You have to worry about transference to kids, pets, loved ones. Your husband doesn't appreciate having a dose of estrogen because he's snuggled up too close to you after you put your estrogen on in the morning. So I mean, it's obviously got some benefits as far as application and that sort of thing. So the pellets for women, once we pellet you, typically I'm seeing that they're lasting probably about 3 to 4 months. It depends on your activity level. I have a marathon runner that just kind of burns through her pellets a little bit sooner. So she usually lasts about 10 to 12 weeks. Men, it's going to last anywhere from 5 to 6 weeks. The procedure cost for women is approximately $300, depending on any nutraceuticals that you buy or supplements. For men, it's $600 to $700 because they get a much larger dose of testosterone than women do. But again, it lasts 5 to 6 months, so there's kind of a trade-off there. It lasts much longer than for the women.
Perfect. So let's talk about, Lindsay took her labs. So let's talk about what her lab work came back as.
So I usually kind of start when I'm talking to patients about with their symptom checklist. I usually start with your symptom checklist when I talk to patients. Is this okay to?
Yeah, sure.
Okay.
So I look at your checklist and I kind of look at, the top half of this is generally geared towards low testosterone. So we see on here, the mental confusion, decreased libido, that sort of thing. Is more associated with low testosterone. Difficulty to lose that stubborn, belly fat. Then when we look at the lower half of the questionnaire, the checklist, we look more at estrogen deficiency or hypothyroidism as well. Those kind of tend to have some overlap sometimes in the symptoms. So obviously we can see that you have some, you've checked off some of the things indicating that you may have low testosterone, also with hypothyroidism in here. So I know that you're on a desiccated thyroid, but perhaps we need to tweak that a little bit to make sure that we're got you optimized. If you're still having symptoms, even though your lab work might say you're normal in the normal range, it's not optimal if you're still having symptoms.
Right.
So just to recap, these symptoms I'm showing, if you feel like you have any type of these symptoms, definitely come in and see Kelly and learn about how you can hopefully feel better.
Okay, so then after we kind of talk about the symptom checklist, I show you your lab work and we kind of go through that. So when we talk about thyroid, again, we see your TSH is what we would call normal, within the normal range. But what people, I find, don't understand is this is a snapshot of our population. We live in the goiter belt in the Midwest, so our population tends to be hypothyroid. So this is where they're taking an average of our population, and that's what they're calling the normal range. So even if you are hypothyroid, you're falling in the normal range, but you're still hypothyroid. You're still having the symptoms. Then we look at your free T3. That is the active thyroid that's found in the body. So free T3, that's a tongue twister, right?
Yeah.
We like that to be about 4. You're at 3.4, so there is some room for improvement there.
Okay.
So that I would probably talk to you about increasing your desiccated thyroid to maybe 1.25 grains or 1.5 grains.
Okay.
To get you up to that, because I think that's when you'll notice the symptoms like the thinning hair, fatigue, night sweats, cold intolerance, the cold hands and feet, that sort of thing. That's when those start to kind of go away.
Oh, good.
Yep. So that's thyroid.
Night sweats are awful.
They are.
They are.
Then we look at your FSH. So FSH is follicular stimulating hormone. So that's what your pituitary is sending to the signal is sending to your ovaries to produce more estrogen. So you're in the normal range for that. That's what we want to see. So you're producing enough estrogen. Your estradiol is actually 211, so you're actually estrogen dominant.
Oh.
So do you take a progesterone?
No.
No. Do you have sleep problems at all?
No.
No. I would maybe talk to you about adding a progesterone, because it is nice for sleep, but it's also going to help with estrogen dominance. It's nice to have that pairing. Sometimes when you have an estrogen dominance and you pair it with a progesterone, you're going to again get that nice mood stabilizing effect. So when if you get premenstrual symptoms, headaches, cramping before your period, that sort of thing, it's going to help with those things.
Awesome.
So possibly adding a progesterone would be helpful for that. Testosterone, you're at 45. So we like our female patients to be between 150 and 250.
Oh, wow.
So you're very low in testosterone. Women start to lose testosterone at age 30. So when we have our kids, especially right after pregnancy, it just plummets. So definitely that's going to help with the fatigue, the mental fogginess, inability to lose the belly fat, just not being able to exercise and actually get anywhere. You feel like you're doing the right things, eating right, exercising, and you just don't get anywhere, and that's what it is. Okay. Then we get to vitamin D. So you're at 31 here, your vitamin D3. We like you to be between 60 and 80.
Okay.
Actually getting you to that range is also, research has shown, going to help protect you against breast cancer, Alzheimer's, osteoporosis, that sort of thing. So definitely I would optimize that with putting you on a vitamin D supplement. And we offer vitamin D with A and K.
Right.
Anytime you're taking a high dose of vitamin D, you want to supplement it with A and K as well.
Okay.
Okay. So those are kind of our recommendations. That's kind of how I would do a consult. Make recommendations about what we would pellet you with, what additional supplements we would do, and if you're ready, we're ready to pellet today.
All right, I'm ready.
All right, cool. Can we quickly go over the supplements? And also, I have a comment. So Jackie says, I'm so happy that I tried BioTE pellets. I have had great results. I have so much more energy, no longer have hot flashes, and sleeping much better now.
There you go.
So congratulations, Jackie. That's awesome. So I know there's some supplements, so let's talk about these.
So probiotics, everybody should probably be on a probiotic. It's good for gut health. Most of our immunity in our body comes from our guts, actually. So just being on a good probiotic and making sure that we're supporting the natural flora in the body. DIM is a supplement that we give patients when we pellet with testosterone. DIM is going to help keep the testosterone as testosterone. Testosterone is metabolized on two different pathways in the body. On one pathway, it gets metabolized into estrogen. It's called aromatization. DIM blocks that from happening. We want the testosterone to stay as testosterone. You wouldn't appreciate it if I gave you more estrogen when you're estrogen dominant. Vitamin A, DK, we kind of already talked about. A lot of people think, well, I drink milk and I sit out in the sun. Well, it's not enough, especially living here in the Midwest. So I recommend everybody should probably be on a vitamin D supplement. And we like to do a high dose, 10,000 international units. Most of our patients are on that. And again, you want to supplement with A and K if you're on a high dose vitamin D.
And then what's this one? This one?
Same thing. It's
Same
just
thing?
Yep.
Oh.
Yep.
So there we go. You can ask for the black cap.
There
Okay,
you go.
perfect. So,
What's the difference between those two?
I'm
The
not
black
sure what
cap and
has
the
it.
cap, because one says 10 and one doesn't.
10,000. This is a 5,000.
Okay.
so if you may not need as much or may need more, that type of thing.
Yep.
So, all right, so we're going to go ahead and get started. You're going to see Kelly and Jessica are going to drape Lindsay, and then we're going to actually watch how the pellet works.
Peter's going to come up.
Are you excited?
I am. I'm a little nervous, but
Really?
I'm excited. Yes, absolutely.
So this procedure, just to let everyone know, I'm going to flip it back. I'm actually going to show these supplements again. This procedure, we do numb you for that, so there is no pain involved. And again, to show these, here's the probiotics. I can honestly say for the probiotics, I take these every day, and I have not had a cold probably in almost a year, which I'm always extremely healthy because of these. And even when I am not feeling well, I take an extra one of these, and it seriously like gets rid of my cold. Another thing I tried, which Kelly's probably gonna hit me for saying this, is my husband Israel gets cold sores. So I took my knowledge and I took the powder of the probiotic and I kind of mixed it up a little bit and put it on his cold sore, and it took it away. Isn't that cool? Yeah, Jessica and I learned that at our meeting on the supplements. So I thought that was really neat. That's why I love probiotics. I think they're really awesome. Jim, again, she explained that is for you have to take this if you're getting any type of testosterone, so keep that in mind. That would be these are extra costs, just for you know. And then of course ADK is very important. So these do not include in the cost of the pelleting. These are extra. I'm not quite sure on the pricing of these. I'm pretty sure they're in the range of a $20 to $40, you know, per supplement, so keep that in mind.
I know these two together is $90.
Okay, so these two together are $90. So do keep that in mind when you're coming in. But however, they're very important, especially this one with the pelleting process. So explain a little bit about the process. I'm going to come back to me because my hair is on fire today, guys. So a little bit about the process. So the first thing you need to do is get lab work done. We can actually do your lab work here, and it's $150 or $60, Jessica? $150, right?
Yep, correct.
So it's $150 for your lab work. If you would like, you can put it through your insurance. You can go to the lab. You can request a lab from us, and we can send that to your lab, and they'll know what to draw for you. But if you want to, $150. And then there is a consultation fee. That is Kelly's fee. That is also $160. That can also go through your insurance if that's something you want to do, and we can take care of that for you. And then the pelleting itself is separate. That does not go through insurance, unfortunately. So for women, it ranges from $300 to $400 every 3 to 4 months. So if you're a Botox user, keep that in mind. So if you're a Botox user, and then for men, it's about $500 to $600 every 5 to 6 months. So for men, it's great. All right, so you ready? Not yet. So she's gonna drape her, because really quickly, and we'll get started. She's going to go ahead and numb her as well, and again, that numbing kicks in right away. There's no problem there. There is some downtime with this, so, and Kelly will go over that after she does the pelleting. Regarding ages, we ask that you probably are over 25 before you start pelleting, just because of growth, but usually I would say 30, good 30s to on up can do it. And again, what the great thing is some people may be candidates, some may not. It just depends. That's the lab work is going to show us if you would be a candidate or not. And that checklist we showed earlier, if you have a lot of those symptoms, I would say more than likely you will be a candidate. So Kelly is ready. She's going to go ahead and get started. All right, so I'm going to come on around here, get nice and close. All right, so really close here. So we do it in the upper.
You're gonna feel my hand here, a little sting.
The upper Botox here, and she is numbing Lindsay right now. And just for your little information, Kelly is actually on top of it. She is also certified plastic surgery nurse as well. So she has.
And I actually just learned that I passed my exam and I am now certified in anti-aging medicine.
Wow, way to go, Kelly. Congrats. That's amazing. So that is a very rare combination. Do you rarely ever get someone who...
The bad part's done, the numbing's done.
Okay.
Now
So the worst is over?
The worst is
the
over.
worst. That's the worst part.
So Jessica is putting on the iodine, is that right?
my skin yellow.
Yeah. So right there is where she iodined her, is where she's actually going to make the incision.
Does it leave a scar?
Good question. Does it leave a scar?
There's a little, it's a stab incision, so it's probably about a centimeter, not even a centimeter, probably half a centimeter, but it fades. Actually, people that I've repelleted, I can't even see where I did the procedure before.
Oh, do you normally do it in the same spot?
I rotate sides, so if you're having it like this on your right side, we'll do your left side next time. And you alternate. Some patients, like for example, police officers, if they they carry gun belts, so sometimes we can also insert in the abdomen as well.
Is this something that once you start, usually you have to continue on?
Right. You don't have to continue on, and it wouldn't be harmful for you to come off of the pellets. You just go back to feeling the way you did before. All right, I'm just going to test the skin here. Anything sharp there?
No.
Okay.
So she's making her incision.
And that's it, just a small stab incision.
Perfect.
This is the trocar, so we introduce the bevel of the trocar and tunnel under the skin. Doing okay? Not having any pain?
No.
Good.
So now she's going to put the pellets, and I'm going to quickly
And these
show
are the
you
pellets.
what the pellets look like. They're like literally a grain of rice. So tiny.
And you just go in easy peasy. That's it.
And done. Just going to close her up and put a gauze on her, and she is good to go.
So we're all
Or
done.
what do you do?
Nope, we don't stitch it closed. We just put a
Band-Aid?
not a band-aid. It's a like a steri strip.
Oh. Will it be sore once the numbness wears off?
Sometimes it's sore for just today, but we put an ice pack on there for you.
Okay. And how long does it take for the numbness to wear off?
It'll be a couple hours.
Oh.
And she is all done. Perfect. Good job.
Thank you.
Done. See how fast that was?
That was
Isn't
very
that
fast.
amazing? And again, one more time, I'm going to just quickly show you what she's going to be needing today. Definitely these two for sure. This is a optional, but these ones are for sure today that she'll be going home with because she did have the testosterone. So right there. And she's extremely low in vitamin D, but you always need vitamin D with A and K, which Kelly talked to you guys about. All right, so really quickly, Kelly, can you tell me what would be her post-care procedures?
So typically after we pellet, if it's the initial pelleting, we'll have patients get lab work drawn. 4 weeks for females, 6 weeks for men. That's
It's about 4 to 6.
4 to 6 for both. And then based on your lab results, we want to make sure that we've hit our mark and got your levels to where we want them to be and got you optimized. If not, we possibly would do a boost procedure. For example, if we didn't quite get your FSH down where we wanted it to be, we might boost with more estrogen, sometimes with more testosterone. So it just depends on the lab work that we get back. If everything looks good at the 4-week labs and they're doing okay, then they just call and come in for pellets when they need them again. And typically I tell patients, you're going to know when you need pelleting again. The first symptom that goes away is going to be the first thing that comes back when you need repelleting. So example, she has hot flashes. She's going to notice a difference within a week with those hot flashes. She's going to notice like maybe she's not using her air conditioning in her car, or a fan on at night. So that's going to be the first symptom that comes back when she knows she needs to come back and get repelleted. Oftentimes too, I'll have patients come in and say, well, my husband told me that I need pelleted again, because the husbands will notice a difference.
I know. And then now, can she go work out, or what is her downtime here?
No swimming or submerging for 3 days after the procedure. No working out the area for 3 days after the procedure. So that's squatting, running, that sort of thing.
Okay, so when you say submerging, she can do showers.
She can shower, yep, just nothing like no pool, hot tub, that sort of thing.
And other than that, she's good to go, and that's it.
And we'll give her all her instructions as far as dressings, that sort of thing.
Perfect. All right, well, thanks, Miss Lindsay. I know
You're welcome. Thank you.
in an awkward position right now,
Right.
so I'll get ya. All right, you guys, so that's it for us. That is BioTE. If you guys have any questions, you can give us a call. We do have a fun incentive here because Kelly does a lot of BioTE. She is offering a free massage for any new client. So if you're interested in BioTE, give us a call. We'll get your lab works done, your consultation, and if you are a candidate for pelleting, you will get a complimentary custom massage here at the Center Yourself Medical Spa, and that is only good until October 31st. So again, if you want that free massage, come and see Kelly, get your lab works, and get your consultation done, and you will get a custom massage up until August 31st, October 31st, excuse me, and that includes you must have your pelleting done by October 31st. Now I'll put the rules, of course, on this video. But again, if you're interested, lab work is $150, consultation $160, and pelleting for women $300 to $400 every 3 to 4 months, and men $500 to $600 every 5 to 6 months. That's it for us. Give us a call, 574-968-9100, or thecenterpc.com. Bye, guys.